All right, we usually save our text messages for the end of the show, but once in a while, as you know, we like to pepper them in throughout the show to add a little spice to the two-way conversation. Over the last year and a half, we've gotten a lot of messages pointing out we tend to talk about COVID a lot, like this one yesterday from Jackie. Brian, she says, it upsets me more than I can say how your show's focus remains on the COVID issue. Do you really believe we are sitting at home with our pencils and paper taking notes on all the stats you share with us? Taking notes? No. Taking notice? Hopefully. Because unless you live through like World War II, this is likely the biggest crisis in several generations. And when it warrants it, we're going to talk about it. Like when our hospitals are operating under crisis standards of care and may do so again. Or when everyday services are shutting down because there aren't enough people who aren't sick or exposed to operate those things. All things that impact all of us. Yeah, there are feel-good features stories out there, which we would love to do a lot more of. But we also can't just bury our heads in the sand when it comes to a pandemic. We are, after all, still in the middle of one. Yesterday alone, Idaho saw its highest ever daily case count since the pandemic began. More than 2,200 cases in one day of COVID-19. And that doesn't include the nearly 14,000 cases still waiting to be processed, backlogged, some of which the state still has yet to process. And with Omicron, the cases out there, they tell us where the virus is spread, but what we're more concerned with are hospitalizations. On January 8th, the last day hospitalizations were updated on the state's website. There were 340 people in the hospital with COVID. It doesn't necessarily mean that they weren't admitted with something else, but they did have COVID nonetheless. However, not all hospitals reported their numbers, so that number is likely and actually probably higher than that. You can see that number isn't anywhere near the peak we saw back in September, which is right there marked on September 24th, but it's starting to grow a little bit. It's something Dr. Megan McInerney at St. Al's told us was going to happen when we spoke with her last week. On Monday, the state reported they had 29 ICU beds available. As of yesterday, there are only 8 ICU beds left, just 8 across the entire state. And no, not all of them are filled with COVID patients, but they're getting filled by a lot of other people as well. Should you write that number down? No, it's on a website if you need it. But should you or a family member need a hospital bed, it might be worth knowing why there may not be one available. So yes, it's important, and we're going to keep talking about it when we need to.
Healthcare systems across the state are seeing the number of COVID patients increase, while simultaneously seeing a decrease in the number of healthcare workers available to provide care due to the large number of healthcare workers who have been infected or exposed to COVID.
Basically, patients need people to take care of them when they're in the hospital. And if those healthcare providers aren't there, that's when the level of care suffers. And so do the staff covering for their colleagues who are quarantining. So some hospitals have changed their protocols, like in California, where according to new state guidelines, healthcare workers who test positive for COVID no longer have to isolate or test negative before returning to work, as long as they're asymptomatic and as long as they wear a mask. And at Legacy Health in Oregon, staff members who test positive are allowed to return to work even with mild symptoms. That would certainly help the situation here in Idaho, right, when it comes to staffing issues. But the hospitals we spoke with say they're following the CDC guidelines, which currently look like this. The CDC recommends isolating for 5 days. And after those 5 days, if you are asymptomatic or if you have not had a fever for at least 24 hours, you should wear a mask for another 5 days. These guidelines were issued before Omicron became the main variant of concern in the United States. So we asked St. Luke's, St. Alphonsus, and West Valley Medical Center to see if their policies have changed with the new variant. St. Luke's, they recently adopted and updated their COVID return to work guidelines. It says if an employee is symptomatic, they are eligible to return to work 5 days after symptom onset. They must also be free of a fever for 24 hours without the help of medication and have improving symptoms. If asymptomatic, they can return 5 days after a positive COVID test. However, employees are not required to return to work if they don't feel well enough to do so. West Valley Medical Center, similar policy. Anyone who tests positive must quarantine for 5 days at least. An employee can not return to work if they are still considered an infection risk with symptoms, and every employee's case is reviewed by an employee health nurse before they can just jump back into work. But once they are ready to come back, they must wear a mask, which is hospital policy. Employees do receive quarantine pay, by the way. We also reached out to St. Alphonsus, but we've yet to hear back about their policies.